All right, so my name's Haley Smith, and today we are going to be talking about IV therapy. So the first thing we want to do, and this would be in the med room, we want to assess the IV bag. So we want to assess that we're making sure we have the right IV, because IVs are irreversible. If something bad happens and we give the wrong calculation, we can't change it. So for today we have the sodium chloride, and we're checking for expiration, the color of the fluid, stuff like that. I am sorry, I do have a cold, tested negative for COVID, and my throat is kind of itchy. I apologize. So the next thing we're going to do, obviously sodium chloride. This is used for when we need to increase fluid volume in the extracellular space. So we would give this to a patient who has extensive fluid loss, like vomiting. They've been vomiting, they've had diarrhea, or they had a hemorrhage. The next thing we're going to do is complete our first check. So we would walk over to the MAR, making sure that we have the right prescribed fluid. The next thing we're going to do is do our calculations. So the doctor has ordered an IVF at 3,000 milliliters for 24 hours, divided by 24 hours, with a drip rate of 10 GTTS per minute. So the first thing we want to do is do our calculations. So for our calculations, we would divide 300 milliliters divided by 24 hours, which you would get 125 milliliters per hour. Then we have to figure out our GTTS per minute. So after we do all the calculations, we would get our answer of 21 GTTS per hour. So that's what we're using. And to double check ourselves, we can kind of like talk it out. We can say if the amount prescribed is 3,000 milliliters divided by 24 hours with a drip factor of 10 GTTS per minute, it would make sense that we would infuse 21 GTTS. So it makes sense. Then we have our second check. So our second check is checking our calculations, saying the same phrase over again, making sure we're all right. And then we would also get our labels out. So a label for our IV bag and a label for our tubing. So the next thing we're going to do is remove tubing from our bag. I already have my tubing out, and I have my IV bag out of the bag. So the first thing we're going to do is make sure our clamp is closed. And it is closed, it's rolled all the way down. And we are going to spike our bag. So my bag is spiked. I don't have an IV bag hanger, but I do have a chandelier in my kitchen. So I'm just gonna hang it off that. Okay, so now that our bag is hanging, and we already have everything labeled, so we're good with that. We're going to prepare our drip chamber. So our drip chamber wants to be at least halfway filled, which I have right here. It's filled halfway. And the next thing we're gonna do is prime our tubing. So we wanna make sure that we have no air bubbles and the fluid is getting to where, where it's supposed to be. So how we do that is while it is hanging, we slowly roll up our dialer and allow the fluid to come down. And we want to make sure at each chamber that there's no air bubbles. So you can flick it, make sure that that's good with that. And also to help with that, you can hold it upside down to get the fluid to move. And we're just making sure, there's another bubble, that all the fluid is getting to where it needs to be. Okay, so at this point I am going to stop it because we got all the air bubbles out. And the next thing we're going to do is this is where we're going to go over to bedside, where our actual patient is. So the first thing we do, obviously wash our hands always. We would come into the patient's room and state the first 5. So wash your hands, ask for 2 identifiers, their name and date of birth, ask for any known allergies, and double check that with the wristband and the MAR. And then we're going to provide privacy by shutting the curtain or closing the door. And then we're going to explain why we're here. So today we're here to give you a new IV bag. So we did that. So the next thing we're going to do is put on our gloves and assess for the IV sites. My gloves are being a little bit tricky today. So we're going to go over to our trusty patient over here, Mr. Smith, with his cool sunglasses and his mask. And we're going to assess the IV site for redness, swelling, and edema. This is where we're also going to palpate the patient and see if they have any tenderness where the IV is, anything like that. We also want to check for phlebitis and infiltrate. So infiltrate is when the fluid from the IV actually leaks out into the surrounding tissues, which is no good. And phlebitis is an inflammation of the vein, where the IV is usually. So at this point, we're going to do our third check. So we would go to the MAR, scan the patient's ID, scan the bag, making sure that we have the right bag. We're going to check our calculations. We're going to make sure that it's what the doctor prescribed. Then the next thing we're going to do, I have my extension here. We're going to go over to the patient and we would clean. We can clean the cap on here, making sure that we're not sterile, but we're clean with the procedure. And I'm going to take my extension and, excuse me, I'm sorry. And attach it to our tubing. Sorry about that. And then, oh my goodness, I'm so sorry. I tried to take this video like 7 times already. We're going to attach this to the actual IV site. We would also flush the extension just to make sure. And then we would do our rate on our tubing, which I already calculated. So it would be 21 drips per minute, which we already calculated. And we already did initial time the IV bag and the tubing. And we counted the drips for a minute. And then, of course, we would clean everything up and document.